Whichever eye hospital I visited in India, I met number of people who had been trained by Dr. Venkataswamy's institutions. It was amazing to see how even in his 80s he was radiating enthusiasm and perseverance for realizing his vision. Dr. Venkataswamy championed the community ophthalmology and using systematic approach to mass screening and surgery, he infused both science and discipline to mass surgical camp. Dr. Venkataswamy implemented his principle that Aravind Eye Hospital must provide services to the rich and poor alike. Yet, the eye care facility must financially support him. The entire Aravind Eye Care system is conducting an average 800 eye surgeries per day. Annually, they treat over 2.5 million patients. They are providing every 30 paid patient free treatment for 70 patients who cannot afford. Aravind has grown into 5 hospitals, nearly 3,600 beds, 26 vision centers. Dr. Venkataswamy gives the message to all of us, particularly aspiring medical graduates, how commitment to a vision can make vision happen. Let me talk about a healthcare giver who answered his inner voice calling. Dr. Somaraju was born 25th September 1956 in Bhimavapuram, and he used to walk 8 kilometers to his school, and he got educated in MBBS, MD Internal Medicine from Guntur Medical College, and moved postgraduate institute PGI Chandigarh, from where he obtained DM in cardiology in 1977. Dr. Somaraju played a key role in setting up the cardiac facility in Nizam Institute of Medical Science. He is one of the founding members of Society of Biomedical Technology and Intervention Initiative, Government of India. Dr. Somaraju founded Care Hospital and set up a benchmark in providing affordable cardiac intervention and cardiac surgery. And we made a coronary stent together. The KR stent, as it was called, resulted in the availability of an international brand of coronary stent in India and the most nominal price. As per Dr. Somaraju, the driving force behind his continuous contribution to treatment of patient, medical education and institution building is the inner voice which keeps on calling him to remove the disease and pain of the people. Now friends, let me third one about a doctor. Let me now discuss about a doctor who has made a mission of reaching the unreached, as a mission of his life. In the present circumstances, the environment, it was inspiring to see how a MBBS doctor has put all his dreams in mainstreaming the tribal citizens of Karnataka for the last 25 years through Vivekananda Kirijana Kalyan Kendra at BR Hills. When I visited BR Hills in 1998 and subsequently 2006, I could see substantial new development in the area. I could see the new tribal hospital, roads, education environment, above all earning capacity of the tribal citizen have been increased in the technology resource center as a base. Dr. Sudarshan is the inspiring architect of this social transformation. Dr. Sudarshan pays particular attention to a special problem of tribal such as snake bite, mauling of the beards, pneumonia, tuberculosis and acute respiratory infection. And solely our tribal suffer from sickle cell anemia, and Dr. Sudarshan developed a low-cost electrophoresis machine for diagnosing the disease. The aim of the medical education should be facilitate application of medical technology for providing best care to the poor, most affordable cost. And Dr. Sudarshan said the greatest joy he experienced was when resuscitated a patient whose lungs and heart has stopped, and when he sees the smile on the face of poor patient who come to hospital with blindness and cataract in both eyes and walk out with full vision after the cataract surgery. Country needs 1,000. Country needs thousands of Dr. Sudarshan for providing health care to our rural citizens. I don't know how many of you undergraduate students will take up such type of missions. While I was working in some organization, we had 14,000 employees who had crossed the age 40. We were concerned about their health. We want to take adequate preventive measures to all the employees could have a healthy lifestyle. Toward this end, we sanctioned a healthcare project. The result, the macro result of the community health examination indicated that 35% of the total people suffered from some form of chronic diseases. Particularly, it was found 30% of the people were overweight, 20% were smoking, 23% suffered from hypertension, and 12% suffered from diabetes, and 7% suffered from different diseases. A team of doctors who carried out the examination counsel each individual and the family members to adopt a lifestyle involving simple, nutritious vegetarian food, abandon the habit of smoking and drinking, and perform a simple exercise including brisk walking. In addition, doctor also gave lecture to the entire community about the need of the preventive health care through food habits, aerobic exercises, and medication wherever possible. Wives of employees and mothers were also advised about the food habits to be followed by entire family for healthy living. I am sure the graduates of CMC, KOCHI will participate in such a community medical program in the region where they are working. This will be a greater social service of the doctors and will ensure the development of a healthy nation. In conclusion, friends, finally I would like to ask you what you would like to be remembered for. You know, the clinical experience everybody can have. But friends, finally I would like to ask you what you would like to be remembered for. You have to evolve yourself and shape your life. You should write it on a page. The page may be a very important page in the book of human history. And you will be remembered for creating that one page in the history of the nation. It can be a page to eliminate the TB from the nation. Or it can be a page to make MMR near zero. Or will be a page to ensure that there is no occurrence and infection such as HIV and other type of diseases. Or can you write a page on how we can provide better quality of life to our senior citizens, how to educate people in preventive care. Above all, each one of you have to take up any one of the field which I have discussed above and find an effective solution through your dedicated clinical work and research. Let me once again congratulate the graduating students. My best wishes to all of you for success in your mission of bringing glory to the nation through excellence in healthcare delivery and management. May God bless you all, friends. Thank you. Now, I have a oath for medical professionals. Will you take the oath? Yes or no? Hello? You have taken breakfast? Your voice, very low voice. Will you? Including nurses. How many nurses are there? Nurses? Including nurses and doctors will take this oath. You are ready? You're not eaten for 3 days. I love my medical profession as a noble mission. I will follow the motto, let my care remove the pain and bring smiles. I will always radiate cheer to give confidence to patients and their families. I will be a lifelong learner. I will practice what I learn, and I will train my team to be competent. I will deliver the quality care with high standards, irrespective of whom I am treating. I will not introduce diagnostic pain. I will not introducing diagnostic pain. What is diagnostic pain? Suppose you are a doctor, new doctors. A patient comes to you. You give a list. You go full scan, 100% scan. You do the X-ray. You do the blood test. You do the urinal test. And you ask all these tests. You go to the business fellow and you give a big bill costing very heavy money. Immediately you got a pain. It is called diagnostic pain. You follow? So, I am sure CMC college graduates will not introduce diagnostic pain, isn't it? Yes or no? I will not, repeat with me, I will not introduce any diagnostic pain. If any patient is unhappy with my treatment, I'll find out and causes and treat the patient with utmost care, free of cost. The most important thing, I will work with integrity and succeed with integrity. I will work with integrity and succeed with integrity. My national flag flies in my heart, and I bring glory to my nation. Thank you, doctors, thank you, and nurses.
Thank you, sir, for those inspiring words. Now I humbly request His Excellency Dr. APJ Abdul Kalam to distribute the certificates to the new graduates.
Dr. Abhay P. Dr. Ajin Edwin. Dr. Ajita V. Dr. Ajmal N.K. Dr. Akash Balu. Dr. Akhil Ramesh. Dr. Anand V. Dr. Anita Wilson. Dr. Anna Skaria. Dr. Anup Joy. Dr. Arati MS. Dr. Arif Anish AN. Dr. Arya LR. Dr. Asha Anna Joseph. Dr. Ashik Chandra KM. Dr. Ashna Aziz. Dr. Ashwati Gopi. Dr. Bhagya VS. Dr. Charush Willie Thomas. Dr. Chippy Catherine Abraham. Dr. Daisy Davis. Dr. Daya Radhakrishnan. Dr. Deepa KP. Dr. Deepa KR. Dr. Deepti Bhaskar. Dr. Dhanuja VA. Dr. Fatima Sahra Muhammad Salim, Dr. Firas Muhammad Anwar, Dr. Gokula Krishnan K, Dr. Harish M, Dr. Hisham Abdurrahman M, Dr. Jane K. George, Dr. Jayaprasad V, Dr. Jisha P.V., Dr. Joji Varghese, Dr. John Abraham, Dr. Junaid Hussain A, Dr. Krishna Chandra Prasad G, Dr. Krishna Priya S.L., Dr. Lakhan M.S., Dr. Lavanya Arun Kumar, Dr. Lubna Vail PDKL, Dr. Marine Benjamin, Dr. Martin George, Dr. Meera Muhyiddin, Dr. Merlin Ann George, Dr. Murray Polly, Dr. Minu Reba Thomas, Dr. Mitra Sarah John,
Dr. Mohammed Asif K, Dr. Mohammed Yazir K, Dr. Nafia K, Dr. Navneet PG, Dr. Neeta George, Dr. Neetu SP, Dr. Neetu Suresh Babu, Dr. Nimmi Chandran, Dr. Parvati R, Dr. Priyanka Prakash, Dr. Priyanka R.P. Babu, Dr. Praise Philip, Dr. Rahul Ramachandran, Dr. Rajesh R.U., Dr. Raji V, Dr. Rajwa Rahman, Dr. Rani Lakshmi UJ, Dr. Rania Azad, Dr. Ravi Shankar Surendran N, Dr. Rajni K, Dr. Remya Rachel George, Dr. Ranjit Vishwanath, Dr. Renju R, Dr. Revati S, Dr. Rukma K, Dr. Sailesh Kumar M, Dr. Sajida KC, Dr. Sanish Mohan PK, Dr. Safilia Nazar, Dr. Sharanya Das SD, Dr. Syed Faisal TM, Dr. Shahida Muchikal, Dr. Shalu Baby Pulimotal, Dr. Shinopi Ashley, Dr. Sneha UR, Dr. Srikant K, Dr. Srikiran TK, Dr. Shruti KV, Dr. Sumaya Sharaf, Dr. Sumit R, Dr. Tamanna Bindu Abdul Aziz, Dr. Tasneem Ashraf, Dr. Tindu Augustine, Dr. Umukulsu P, Dr. Vidya Mohan, Dr. Vijesh C, Dr. Vineet N, and Dr. Vinita Priya V. Thank you, sir.